Severe nocturia, nighttime urination. What are the causes? How do we evaluate and the best treatment options? Waking up once a night to pass urine can be normal, but waking up 2, 3, 4 or more number of times every night is not normal and it should never be ignored. Severe nocturia is one of the most exhausting urinary symptoms. Quite often, patients tell me, "Doctor, my sleep is completely broken. I feel tired all the way. I'm scared of drinking water at night." So if you are waking up multiple times at night to pass urine, you're not alone. I regularly explain common urology topics in very simple, practical language. So do consider subscribing if you want a clear guidance without any confusion. Coming back to our topic, nocturia. So what exactly is nocturia? Nocturia means waking up from sleep to pass urine one or more times during the night. From a medical point of view, waking up once occasionally may be normal. Waking 2 or more times regularly is considered abnormal. Severe nocturia is not just a urinary issue. It is a sleep disorder, quality of life problem, and sometimes a warning sign of some systemic disease. Why nocturia is so common? Nocturia happens because of one or many of the 3 mechanisms. The bladder cannot hold urine well. Sometimes the bladder does not empty properly, or the third cause being the body produces too much urine at night. So understanding which mechanism is responsible is a key to successful treatment. Treating nocturia blindly without identifying the cause leads to frustration and failure. Prostate and nocturia, how are they related? In men, prostate enlargement is very common after the age of 50 and it's one of the cause for the nocturia. When the prostate blocks urine flow, the bladder becomes overactive. It cannot empty bladder completely and it also sends frequent signals to urinate. So what does it cause? It results in repeated nighttime urination. However, not all nocturia is due to the prostate. Many patients undergo prostate enlargement and treatment and they still have nocturia because of another cause which was missed. So what are the other causes of severe nocturia? The other causes include overactive bladder, poor bladder capacity, excess fluid intake late in the evening, could be diabetes or a sleep apnea. Many times heart disease which can cause fluid redistribution and nighttime increased frequency. Also certain medications like diuretic can lead to nocturia. In elderly patients, multiple factors can coexist. Why just reducing water does not solve the problem? Many patients try to reduce nighttime urination by stopping water intake. This often leads to dehydration, constipation, urinary infection and kidney stones. Problem is usually not water intake, but how the body handles fluids. Proper evaluation is far more effective than fluid restriction. How do doctors evaluate nocturia? So the evaluation of nocturia is very structured. It includes a detailed medical history, day and night urine frequency pattern. We also ask for ultrasound to assess bladder emptying. We assess the prostate enlargement in men, what are the blood sugar levels, and the kidney test. And sometimes the sleep assessment is done. In selected cases, a bladder diary helps identify the exact cause. So what are the treatment options? The treatment depends entirely on the cause. The prostate-related nocturia improves with medication or surgery, while the overactive bladder, it responds well to the medication. A nighttime urine overproduction may need timing change of the medication, and without saying, lifestyle modification plays a very important role. There is no single pill that works for all the nocturia. So when nocturia improves after surgery, in patients where nocturia is primarily due to the obstruction, procedures like HOLEP or laser surgery for the prostate can significantly reduce the nighttime urination. However, improvement may be gradual. Patients should understand that nocturia may improve step by step as the bladder function recovers. So what's the take-home message? The take-home message here is severe nocturia is not something you have to live with. It has causes, it has solutions, but it requires a proper evaluation. Treating the right cause restores sleep, energy, and overall health. So never ignore persistent nighttime urination. Your body is trying to tell you something. Thanks for watching this video, and if this video has helped you clarify your symptoms, share it with someone who may be silently suffering. Thank you.